Hello and welcome back to another episode of Becoming Relentless. I am your host, ELENOA McCabe. I'm an IFBB bikini pro and an online fitness coach and your favorite fitness podcast host. Today, I am super excited. I have a guest on the podcast and she is going to speak to us about all things bodywork. So listen up, get your notepads ready, and we are going to dive right in. I would like to welcome, drumroll please, Marissa. Hello,
Hi.
welcome.
Hey, thank you so much. I'm so excited to be here.
Yes, I'm excited to have you on. Go ahead and tell everybody, where are you from? Where are you located?
So I'm located in Macomb, Michigan. So like 30 minutes outside of Detroit. So kind of metro Detroit area. But
Yeah.
yeah, we're up in the D.
Oh my gosh, I love that. And what is it that you do?
So I technically am a physical therapist assistant. I'm licensed in the state of Michigan, but I currently started my own business called Marissa Moroz Bodywork. And basically it's a bodywork service for athletes, bodybuilders, really anybody can benefit from it, but it is to promote healing, in increasing range of motion, things like that, getting your body to an advantageous point to train better, even just perform better day to day.
Oh my goodness, yay. I think this is so perfect. Everybody, listen up, perk your ears up because it's so easy to get into the gym, especially as bodybuilders. And this podcast, like originally we started just focusing really on bodybuilding. I think we've kind of grown altogether to encompass a lot more like fitness, health, wellness. But for my bodybuilders out there, body work is so important. And I'm such a big proponent of getting regular body work done. So I think we should start at the beginning. Tell us a little bit about your background and how you specifically got into doing body work for more of the athlete population.
Yeah. So, like I said, I've been a physical therapist assistant for 7 years now, which is crazy. But I work in and have always worked in a totally different setting than anything like this. So I actually work with people who have neurological disorders, so brain injuries, spinal cord injuries, stroke, MS, any type of neurological condition. I treat them, do physical therapy for them. So it's totally different than even just regular physical therapy. But I got into the bodybuilding world, honestly, back in like high school days when Instagram really wasn't a thing and people had like YouTube channels, and that was kind of the primary way of doing things. So I remember following a bunch of like, it was a range from bikini girls all the way to like Kai Green and Phil Heath. That was like their time frame,
Yeah.
and was just in awe with it. I thought it was so cool, had an interest for it, whatever. And then a few years ago, I actually went to my first bodybuilding competition. And I was like, I left there in awe and was like, I have to do this. Like, this is incredible. These are people I went for my sister-in-law, but I was like, I have to do this. So from there, it kind of just, I started to go to more and more bodybuilding shows. I went to my first pro show, which was incredible. And then from there, went to like the Olympia to watch as a spectator and was just intertwined in the world.
Oh, wow.
And then I tried to start my own journey with bodybuilding and getting into it, training for it, things like that. And it just kind of all warped into this idea of how can I be involved in this world while also helping people and also providing a service to people that need it? Because you don't realize how many
Totally.
people, day to day or specifically bodybuilders need this type of treatment, like you were saying. So it really does help with posing, training, all those things. So it kind of just warped into this big snowball effect of like, how can we provide something great to these people who are putting in the work?
Yeah. Oh my goodness, that is amazing. So, have you yourself competed? Did you do
I haven't competed yet. I had plans to compete. It was something that I had been working towards for the last like 2 years or so. And then once I started coming up with the idea and really kind of jumping ship with going full force into this, I was like, it was no longer a priority. This took precedence. And then, it kind of
Got it.
went from there.
Yeah.
But I still want to compete. The passion is still there. I know I will, but this is just the
Yeah,
primary thing.
you found your passion, like, within the sport already, which is
Yes.
really cool, yeah. I don't I honestly I don't think that people need to compete to, like, love the sport and bodybuilding, and like you said, you just fell in love with going and being part of being a spectator, being a fan of the sport. I think
Yes.
that's really, really cool.
Yeah, and I think what you had said too, it's so true because for the longest time, I wanted to compete, and then my thought process was, well, in order to do this, even to do the bodywork stuff, I have to compete in order to have some type of credibility. And no matter what it was, I thought that competing equaled credibility, and that's not the case. And that was something that I really had to kind of work through and get over in order to, like, level up to be able to do this.
Yeah. That's so funny that you say that because I just had a conversation like in this similar vein with somebody else about how sometimes competing becomes like a validating factor where
Yeah,
like as a coach, like early on in my days, I was like, well, I have to go pro so that I can
right.
coach other competitors. Like in my head, it made sense. But when
Yep,
you actually sit down and think about it or say it out loud, you realize, okay, wait, that's not actually the case. You don't have to completely go through the full journey to still be able to appreciate it, understand it, and help people who are going through the journey. Like,
exactly.
yeah. So I think that's so cool. Um, and I'm excited for the day that you do step on stage. I think you're gonna love it. It is,
I know.
it's
That day will come. I don't know when, but it will come.
it's very exciting. I will warn you, it is a little bit addicting. You like step on stage
Yes.
and then you're like, oh, I love it. I'm gonna keep doing it.
I know, and I grew up dancing, and I was in pageants and things like that, so I've always been, like, on stage.
Yeah.
So, that aspect of it doesn't scare me, and I think that's what drew me to it because I was like, "I could do this. I This is amazing," and this is like the adult version of performing, you know what I mean?
It
I'm
totally
not a
is.
professional dancer, I'm not on, Broadway or something, but this is a way to, like, get on stage and put it out there, so I after my first show, I was just in awe of, like, what it was.
Yeah, that's exactly what happened to me too. I went to one show and then I decided like, "Oh, I wanna do it." And then I
Yeah.
just jumped right in, I did it, I had no idea what I was signing up for,
Yep.
but then the moment that I stepped on stage that very first show, I fell in love. I was like, "Yep, this is where I'm supposed to be, and I'm gonna figure out how to help people." Same thing. I was like, "I
Exactly.
wanna help
Yeah.
other people who are in the sport because I love it so much, I'm so passionate about it." And so here we are, and that's how Becoming
I know.
Relentless came.
That does give me chills because that's just how it goes.
It is. Yeah, you find that thing that lights the fire inside of you and then all of a sudden like nothing matters. You'll do the hard work. You're passionate about it. You won't sleep. You're just so obsessed about this one thing. And I
Yes.
think that's such a beautiful part of life is like finding your purpose within what you're doing and serving others with it.
Exactly, and that was something that I was a little fearful of with starting the bodywork business was because, I love physical therapy and I love what I do, and the big part of why I do it is to help people and things like that, and my worry when I was starting this was like, am I still helping people? Am I still making an impact? How can I incorporate that into this? And I think just after I started to get clients and get a flow with what I was doing, now it's fine because people have testimonials of how they
Mhm.
felt and how things changed for them, which makes me feel great. But at first, when it is unknown, you're kind of like, is this going to give me as big of an impact as I want? Or, things like that. So
Right.
it was very scary in the beginning to not know, like, is this gonna fulfill that impact bucket that I
Yeah.
feel like I need? And it has, so I'm very grateful.
Good. Yeah. So when you did start at the beginning,
Mhm.
what do you feel like changed for you to make you go through with it? Like what actually sparked for you to take that leap? Because when you're scared,
Yeah.
sometimes you hesitate and then if you hesitate too long, you miss the opportunity. So what was it for you that you felt like, okay, I'm going to take this leap?
Yeah, honestly, to be honest with you, I had had this idea, in my head probably about a year ago. I had made, like, a logo and, just was, like, full force into it, and then I got scared and didn't do anything with it, and then, again, it still was, like, knocking at the door for me,
Mhm.
and it was like, "You should do this, you should do this," and it was always in the back of my mind, um and it really wasn't until I had the support of my husband and my friends to just be like, just start one step at a time. Buy your tools, get a table. Cause the plan was to always
Mhm.
just do it out of my house type of thing. And it was like, just buy the first couple things, get what you need to get started, and then just do it. And it took a lot of this also wasn't including the, like, years that it took to, like, get past that mindset of, like,
Mhm.
fear, but I think just taking it, like, one step at a time is really the best way, because if you look at the road ahead, it's way too long of a road. Like, you will
Right.
be scared and not do it, and that's what happened to me last year, but once I started to kind of just take it one thing at a time and the next, that's kinda when it all just fell into place.
Yeah.
So, there are still things that I worry about, but I'm like, "You know what? It will take care of itself. I'll figure out when I get there."
Yeah, you don't have to know the whole path, you just have to kind of
Yes.
take it step by step. Oh, very cool. So once you started buying the tools and you got your table and everything, was it just a matter of, like, word of mouth, or how did you get started with getting clients?
Yeah, so I posted just, like, on my Instagram. I have, like, 200 followers of my close family and friends, but, I started putting out business cards just at my local gym. I was promoting it on Instagram. My friends were really supportive. The community, it's funny because the area that I'm in
Mhm.
has a very tight-knit bodybuilding community. So it's kind of small, everyone kinda knows everyone, but, so once it kind of caught that way, it kind of caught like wildfire. So my plan was to put out business cards to gyms, reach out to different gyms, and then, just go from there and see what picked up, but it kind of really word of mouth has been the biggest way that it's grown.
Yeah.
So
I love that. I was gonna say there is a pretty strong bodybuilding community, I think, in Michigan. I know a couple people who live up there. Um,
mhm.
and the bodybuilding world is relatively small, so, like, to
Right.
begin with. So when there's, like, the pockets, it's really nice. Yeah.
Exactly.
Cool.
Exactly.
Okay. Well, I love getting to know a little bit more about you. I do want to ask, just for listeners who are maybe curious, like, what exactly is body work? How would you define it for the listeners?
Yeah, so there's kind of like a technical, science-y way of describing it, and then just kind of the day-to-day way to describe it. So the technical version would be that it's a stimulus that provides some type of, like, neurological, physiological, even psychological response in your body, which allows the body to have some type of reaction, whether it's more blood flow, whether it's relaxation, that really allows the body to be in a state to be ready for change. Now, what that means is basically, if I'm working with somebody, I'm using various tools, I'm using my hands, different techniques to elicit some type of change. I'm not putting things back into place, I'm not realigning things like
Mhm.
that, but there is some type of physiological change that comes from, like, an external stimulus.
Okay. So when you talk about, like, realigning things, that's more chiropractic work?
Yes, yeah,
Okay.
so, not to say that you can't have a tight muscle that's pulling on something that's maybe, like, twisting you funny, but for me to promote, like, that I can fix your ribs or put them back into place, or, you know, fix your hips, like,
Mhm.
those things aren't that's kind of false advertising. There are different techniques to promote a change that will help with that, but
Right.
that's not the nature of what I'm doing.
Okay, cool. So what specifically do you specialize in with your body work?
Yeah, so I use a couple different tools. I use cupping as one of my strategies, and then I also use the instrument assisted soft tissue mobilization.
Mhm.
So that's commonly known as the Graston technique. So basically, those are just tools that I use to, reduce. Actually, they promote inflammation, which can improve blood flow, which brings healing, things like that.
Mhm.
I also use various manual therapy techniques with my hands and with my body, which I've learned through physical therapy that promote, you know, allowing things to be more, um, just move better in the body.
Yeah. So with bodybuilders specifically, do you find that there is an area that they most need body work on, or does it
Yeah.
depend?
So
Yeah?
it's pretty funny because a lot of a lot of clients that come to me, what we'll do is I have them give me a little rundown of what their primary concerns are. A lot of people will say, my posing feels really tight. My training just kind of feels off. I feel more inclined to, on one side versus the other. And when somebody has that situation, we typically will look at their posing. So I'll have them stand, pose, go through quarter turns, all of that. Meanwhile, I'm assessing the symmetry. So I look at symmetry of if one side's higher than the other, if their shoulder blades are moving in a way that's advantageous,
Mhm.
just kind of working down the chain. So I'll look at shoulders, back, hips, even knees sometimes, even ankles can affect things.
Yeah.
Um, Really looking to find those asymmetries and then addressing them from there.
Okay. So with the asymmetries, do you find that, like, certain divisions have certain compensations? Like, I know for me as a bikini girl, like, I am always having tight hips, tight lower
Mhm.
back, and then if I don't take care of it, it starts, like, working its way up my back. All of a sudden, my left shoulder blade's
Yep.
wonky. Do you tend to see that too with, like, the other divisions?
Yeah, definitely. And it's so funny because a lot of men will book like upper body sessions and a lot of women will book lower body sessions. And when looking at the upper body, a lot of the male competitors have difficulty mobilizing their shoulder blades. So, the problem with that is if your shoulder blades are not moving in a way that's advantageous or fluid, they're going to be tight, they're going to stick, they're going to move things and push things in the way that may not look the best when you're posing.
Mhm.
So, typically males have more trouble with upper body symmetry, specifically through the shoulder blades and the shoulders, where women may have more asymmetries through their hips or through their low back, especially with like bikini and wellness posing with the twisting.
Right.
One side is usually a little bit more tight than the other. Um, and then in the back pose, especially too, if it's really off, it can even throw off your hips.
Yeah, I have actually experienced that myself. My hips, like, at the end of a long prep will be
Yep.
misaligned because one side is
Hmm.
just being overused, and then if I don't
Yep.
stay up to date on the bodywork, then
Yep.
it yeah, gets I've gone through that myself, so definitely have been there. So if there's athletes at home listening to this and they're like, "Well, I feel tight, but, like, I think I look symmetrical." How can they tell? Are they gonna be able to tell, like, in their gym performance at all or mainly through posing, or what have you seen?
I think the biggest thing is training would be the first telltale sign. So if you're training and you're noticing that you're getting more of a pump on one side versus the other, if you have a little bit more range of motion on one side versus the other, those would be little key points of okay, maybe something's off. No one is perfectly symmetrical. We all have our dominant side, our other side is maybe a little bit weaker, less coordinated, whatever the case is. But if you're noticing a significant difference in like pump on one side or training, you're significantly weaker on one side, those would be pretty big indicators to like have something going on.
What would you recommend they they ask for? So I know some athletes or even clients that I coach, like they'll say, well, should I get a massage? Like, should I go see my PT? Do I need a chiropractic adjustment? So how would they know which is like the right avenue to go down?
Definitely. So, and that's where it gets a little tricky because I've had some clients come to me who have gotten massages consistently for the last couple years and always thought that it was beneficial, which
Hmm.
it is. Massage is a great tool to improve your range of motion, your muscle mobility, things like that. Um, the difference is that with cupping and scraping specifically, those will promote some type of inflammation to the muscle. So kind of like when you train. When you train, you're kind of breaking down the muscle in order to repair and build new muscle. The same goes for body work. So we're creating little I don't want to say injuries, but little injuries to the muscle in order to promote blood flow, which promotes healing. So looking at the differences between, okay, is this something where just I'm a little sore and I hurt, or is this significant pain and difficulty with the movement itself? So I would look at, is it just muscle tightness or is it an actual full range of motion issue?
Okay. Oh, good to know. I'm not sure if I knew that before. I don't think that I did.
Yeah, and it's honestly, it's difficult because each whether it's massage therapy, physical therapy, or, chiropractic as well, they're all very closely intertwined, but
Mhm.
some of them have a little bit key differences. I know there are some chiropractors who do massage and who do cupping. I know there's some massage therapists that do cupping. I know there's physical therapists that do, all, but I think the biggest thing is just if it's a mobility issue from the joint, so whether it's from your shoulder or you're
Mhm.
having pain, that's something that maybe needs more addressing through like a physical therapist or even a chiropractor.
Okay. Yeah. I mean, that makes sense, like, when you think about it, because the joint you can't really go to a massage and get actual, like, relief from just
Right.
relaxing the muscle around that joint. Like, there might have to be a different sort of adjustment, and like you were talking about promoting inflammation and, like, bringing more blood flow.
Mhm.
When there's more blood to that area, it carries, like, more nutrients, more oxygen, all that stuff, right? Is that what it would
Yeah.
help with? Okay,
Yeah.
cool.
Yeah.
So, I think we kind of touched on this, but what are the most common compensations that you see in athletes, and how does your specific body work help with these compensations?
Yeah. So typical ones would be a lot of shoulder scapular movements. Um, For posing specifically, one major one for shoulder and scap mobility would be like a lat spread. So a lot of times if a male goes into, or I guess a female too, but if they go into a lat spread, one side when you're assessing, one side the shoulder blade might kind of move just as it should,
Mhm.
and the other side might be a little bit more stuck. So all that means is that typically the muscles on the inner portion of your shoulder blade are tight and they're not able to move in the way that allows the shoulder blade to move. So, with the posing specifically, shoulder and scapular mobility for lower body, again, hips might be one off more than the other, a little bit of rotation forward and back. If you're noticing a lot more low back pain, with certain movements or certain workouts, that's a big indicator as well. Twisting, things like that.
Yeah, I think that's kind of how I started to notice mine too, is like training glutes. If I wasn't getting as strong of a contraction on one side versus the
Mhm.
other, I'd be like, okay, I think I need to go get something done because
Exactly.
something is off. Like, our bodies are always talking to us. And I think
Right.
a lot of the time, like, as athletes, because we
Yeah.
are like in a contest prep, or we are so focused and like kind of in our little bubble, we think like, oh, it's
Mhm.
fine. Like, I'm just sore. Like, I'll
Right.
just deal with it or push through the pain or whatever it is. But sometimes I do think, well, not sometimes, all the time, I think that it's important to take the feedback that our body's giving us and then do
Right.
something with it. So,
Yeah, definitely. And it's hard to It's hard to know sometimes if it's just like, am I just sore because I worked it out, or is it an ongoing issue? And I think the time frame is an important key factor too of if the time frame is lasting for weeks on end, months on end, that's different. If you're sore for 2 up to maybe 4 or 5 days sometimes from a really intense workout, that's just kind of the name of the game, but if
Right.
it's a consistent issue, that's different.
Yep. Yeah, 100%. I'm thinking there was a time so after I got my surgery, I got a breast augmentation, my
Mhm.
back was hurting
Yeah.
for so long, and I was just like, "Oh, well, it's
Mhm.
from the surgery, like this and that." And then I
Yep.
finally went and got it worked on, and then it took months from that point to actually, like, heal whatever I had done. Like, my body had just tightened up and created, like, scar tissue back there, like, everything
Yeah.
was locked up. And the person who was working on me was like, "Why didn't you deal with this sooner?" I was like, I just thought it
Right.
was what it was, you know?"
Exactly,
Yeah.
exactly. And that's the thing with compensations is that sometimes we don't even know that they're happening. So, if we have a little bit of an injury or a tweak or, a bias towards one side, your body on its own figures out ways to prevent more injury or to protect itself.
Right.
So sometimes those compensations take up to maybe 6 months, up to a year to present itself as a problem.
Mhm.
And then you're like, why all of a sudden is, this shoulder up to my ear? But little did you know that 6 months ago, when you were doing like a lat pull down and you looked to check out your gym crush, like, it tweaked something. And then your body just kind of compensated because it didn't want to hurt itself. So as far as compensations, sometimes we're not even really aware of it.
Right, and then when they're brought to your attention, you kind of have to think back and be like, "Okay, when did this actually occur?" 'Cause like you're saying, these compensations, they're not inherently, like, a bad thing. It's your body trying to protect you, trying to keep you,
Exactly.
like, safe in its own way. It's just it doesn't always serve us down the road, so
Exactly. Yes.
cool. So, I don't know if there's actually a difference, but I was wondering, like, there specific benefits for body work specifically for athletes compared to non-athletes?
I would say yes and no. I think it depends on what you're trying to get out of the session. So oftentimes for somebody who's working just day to day, who's maybe not an athlete, lives maybe more sedentary lifestyle, if they're working a desk job or whatever the case is, there are still going to be compensations in the body. There's still going to be areas that are taking more of a load than others, and they're going to need those areas addressed. So for athletes, I think it's just more common because there's a repetitiveness in the training and the
Mhm.
posing, and you're constantly assessing things. So it's easier to pinpoint those areas because you're constantly looking at them. And sometimes you have a lot of eyes on those things. You have a posing coach, you have a bodybuilding coach,
Right.
you're checking yourself out in the mirror, you're taking photos of yourself. So there's constantly eyes looking at how things are staying symmetrical. But for somebody who's not in the bodybuilding world or who is not an athlete could still benefit from the same service. It's just they're maybe not as inclined because they're not aware of those issues.
Right. For somebody who is more along just, like, the general population then, what's the frequency that you would recommend that they do go get some body work done?
Yeah, I would say a safe zone would be like 1 to 2 times a month.
Mhm.
Um, depending on the severity of what they have going on, but typically like 1 to 2 times a month is generally the best and safest bet.
Right. Okay. And then for athletes, would you say
Mhm.
that same frequency, that same cadence, or a little bit more often if they can?
If they can more often, that is great. I still recommend no less than 2 times a month for athletes.
Right. And then between sessions, do you give athletes, non-athletes, whoever you're working with, do you give them things that they can do at home as well to kind of help with the mobility that you're restoring, like exercises, stretches?
Mhm. Yeah, I usually, again, depending on, what the situation is, but I'll typically give them some stretches to do that may contribute directly to preserving what we've worked on in the session. So, if it's like a low back issue, if they get up after the session, they feel like, wow, I feel great. Like, I don't want this feeling to go away. Some general things that they can do are, basic stretches that I'll maybe show them, applying heat, things like that, just to prolong it. And that's why the frequency becomes important because it kind of gives your body time to go through the training again, to live day to day life, and then see how long you can get the benefit for. And then we can adjust the frequency from there.
Right. That makes sense. Yeah, that makes a lot of sense. Okay. So walk us through what a typical bodywork session with you looks like.
Yeah. So whenever somebody books with me, I have them fill out a little questionnaire of just some general, like, what's going on? What are you looking to get out of the session type of thing? And then I ask them if they're a competitor or not as well. When they come in, we chat a little bit about what they've put in their forum. And then I usually will do some type of assessment tool. So I'll either look at their flexibility, their range of motion, things like that, just to see what's our starting point. I assess if they're having pain when we do certain movements, what joint is limited, things like that.
Mhm.
And then from there, we lay on the table. I have them flip around throughout the session, use those tools. I'm constantly checking in with them to make sure that things are feeling okay, that it's not causing too much pain or discomfort. The thing with bodywork sessions that I always try to promote is that it's not a comfortable session. It's not the most fun,
Mhm.
but it's the most necessary. And I always inform people like, this is not a massage. You're not coming for a spa treatment. I got like EDM music playing, the spirits are high, we're chatting the whole time, type of thing. So I always want to make sure that people are well equipped to, know what they're in for and
Mhm.
understand that this may be a little bit uncomfortable, but you're going to feel 20 times as great when you're done. So, you know, I've had clients where we spent the whole time just cracking jokes and laughing. Sometimes I don't talk at all, and that's totally fine. But um, I try to bring clients into a place where they can feel relaxed and have the best benefit, but also get the most out of their session.
Right. And understanding, like, I think it's important what you said that it's not going to be a spa session. Like, we're not going and just kind of laying there and relaxing. Like, it's called body work for a
Right.
reason. There's going to be, yeah, I remember my first few sessions, just not that I wasn't prepared, but also, like, as a bodybuilder, you kind of learn to love pain. And
Right.
so, like, it was kind of hard to find the line between, okay, it's painful, but I can take it, or like, oh, it's painful and I think I should tell them that it's
Exactly.
painful.
Exactly.
Um,
Yeah.
yeah. So do you find like with bodybuilders that since we do have like a little bit of a higher pain threshold sometimes,
Mhm.
are we able to communicate that well? Do you feel like you have that good cadence with most of your athletes?
Yeah. Oftentimes, a lot of people are like, um, that, "Oh, yeah, I can take more." I'm like, "Are you sure about that?" Because, it can get intense, but I
Right.
usually, like I said, I'm always constantly checking in with my clients and making sure that things are good. And you can, even if somebody is maybe not as comfortable to say something, you can tell on their face, like if they're like wincing or
Mhm.
making, facial expressions and things like that. Or there's certain responses in the body, like I talked about earlier. It is a physiological change in the body. So even like signs like goosebumps or sweating or things like that, those are fairly common physiological changes that the body just does because that's what's going on.
Mhm. Yeah, and I love it seems like you're very aware too of like what your athletes are doing, like what
Mhm.
you guys are talking through it. And so I think that's important too. Like as somebody who's providing care, you are paying attention and you do care about them as an
Right.
athlete, an individual, you're making sure you're watching these signs. It's not just like go in and do your thing and they don't get to say anything either. Yeah.
Right. Yeah, and I think that that's something that working in physical therapy has given me an advantage from, is that as when you're working in physical therapy, your job is to constantly be assessing and making changes from those assessments, whether they're verbal or just physical from what you can see. And that's something that I really pride myself on. Even when I look at posing, I say to my clients, I'm not a posing coach, but I'm confident in my assessment skills to know this is what we're looking at if you're holding a pose. And this looks off to me, type of thing. And even whether it's before the session or during the session, that is something that really is important to me, that I'm assessing the situation, making sure that all things are good and that, they're getting the best benefit out of it.
Yeah. It's so cool. It's just every time I talk to somebody who's in, like, the bodybuilding industry, it just reminds
Mhm,
me, like, it really does take a village to get somebody on stage. Like, as much as it is a solo journey, there's also so many players that come in, like your coach, your posing coach, your bodywork, your
mhm.
chiro, like all of these different things. The people at the gym, like it just,
Yeah,
there's so much support that goes into this sport, and I love it. I love to see it. And I love to hear like how much you really do care about your athletes and like taking care of them, making sure their poses are symmetrical, because that directly affects how you place. Like that will directly
mhm,
affect their journey and how they feel on stage, how they perform.
yeah.
Yeah, so I really love I can hear how passionate and like how caring you are about the
I
athletes that you
appreciate
work
that.
with. Yeah. So I'm having a good time. I love learning from
Yeah.
you.
No, for sure. I know, it's so funny because I just never thought that I would be in this position, you know what I mean? And I thank God every day because when you look back, how I was explaining like the timeline of kind of how I got here, when you look back on it, it's like you can connect the dots, but going through it, you're like if somebody would have said, "Marissa, you're gonna like own this business and work on NPC, IFBB, Olympians, amateurs, all these people," I would have been like, haha, that's funny. Like, I would have never guessed. And
Right.
I think one thing that's so special about working on bodybuilders specifically is that it motivates me because bodybuilders are people who are trying to achieve their potential. Like everyone is working towards their best self. And that is something that I always strive to do and just be aware of. And to be a part of that journey for somebody, it helps me just feel good about it because it's easy to work on people who are motivated to bettering themselves. You know what I mean? So it makes
Yeah.
my job easier. And, people are very grateful because they understand the significance of what bodywork can do for them.
Yeah, 100%. I love that. And I'm very big on gratitude and being grateful. And also, I like a large part of one of my core beliefs is that we are put on this earth to serve others and help others as much
Yes.
as we
Yeah.
can. And so being able to do that through whether it is like hands-on, like what you do, you literally are hands-on, you're in it with them, you're helping them, or through this podcast, like putting out
Mhm.
information, connecting with other people, creating like genuine connections just with so many different people because we have
Exactly.
like a shared human experience. It's just, yeah, it's something that I definitely don't take for granted. And it's so cool to think about your journey in that way, that you went to a
Yeah.
bodybuilding show, fell in love with it, and now here you are with your own business where you're directly serving something that you're just passionate about.
Right. Yeah. It's very rewarding for sure.
Yeah, definitely. So I know when we were chatting before, we talked a little
Mhm.
bit. You said something in our conversation before we started recording, but you had said something about pulling out details.
Mhm.
And I hear that a lot. Like on social media, people will be like, oh, getting the details pulled out. But what exactly does that mean?
Yeah, so pulling out the details really just means that we're creating that like HD look in a bodybuilder. So oftentimes, the closer that somebody is to show, the more detail we're going to get. Obviously, you're just more leaner, your muscles are popping more, all of that stuff. So When we're pulling out the detail, we are usually using a tool, so probably scraping, pushing out that extra water, all of that lymph that just kinda sits, that doesn't get a lot of movement.
Mhm.
We're really just kinda pushing out that last little bit of water retention, and then kind of when, like, somebody stands up and they're done, you can really see that pop. Their lines are deeper, they're just more crisp. It's like that HD effect. So that's kind of what we mean when we're pulling out detail. I had worked on a guy who was like 2 weeks out. I posted him on my Instagram, and he's shredded completely, like,
Mhm.
coming into my session, and I'm like, "Okay, we're gonna work on some mobility stuff, since you're 2 weeks out, we'll focus a little bit more on, like, ab detailing, really getting into, like, the finer details." So, we were scraping away, and then he stood up, and we turned on the light, had him pose, and he looked like he had time traveled, like, a week before the show because his detail was just way more crisp, his lines were deeper. I don't know, I think it's just the water is why, but I don't know what the magic is behind it, but when you kind of push some of that out, it, like, dries you up and
Yeah.
looks awesome.
Would
So
you recommend getting that done in a certain time frame, like 2 weeks out, 1 week out? Is there such a thing as, like, doing it too close to show?
yeah, so the thing with getting done close to show is you have to just be mindful of the tools that you're using and, like, the pressure you're applying.
Mhm.
Oftentimes, if you go pretty light, you can still get the same benefit without, like, the potential of bruising, and if there is a little bit of markings or something, it's usually enough to be covered up by a tan, but the closest I've worked on somebody to show day was the day they were leaving in order to drive to the show, so it might have been, like, 1 to 2 days out,
Okay.
and then the furthest I used to that sweet spot is kind of like the first day of peak week.
Okay. Yeah, so, like, 5 days or 7 days? 5 to 7 days
Yeah.
out?
Yeah,
Okay, cool.
exactly.
Good to know. I'm gonna note that down for myself.
Yes, and actually, I have the opportunity to go to the Olympia this year
Yeah.
to work on athletes. So, that was kind of a thing where I was like, "Okay, where is that sweet spot of too close to show day, a little bit far out?" So,
Mhm.
even for Olympia specifically, I will be, taking clients like, Friday's the first day of, competing. So, I have sessions from, like, I believe Wednesday and Thursday. So, kind of in that closer show day, but if it is something that can be pulled out, that's also the best time to do it.
Yeah. Yeah, and I think also, like, the environment matters because I know a lot of athletes travel into Vegas for the
Right.
Olympia, and so being able to have you there, that opportunity
Mhm.
to get some of maybe that, like, travel fluid off or if they've been stressed or sick or whatever, because anything can happen, but that's
Exactly.
really cool. Wow. Is there s can you say, like, is there somebody you're really looking forward to working on?
I I have a couple people who have given me, like, a yes, but haven't officially booked yet.
Mhm.
Um, so I don't want to say
We
specifically,
can say
but
Olympians.
Olymp and
Yeah.
they are Olympians who have, been competed at the Olympia before,
Yeah.
and I am potentially we have worked together in the past, but I'm potentially working on this Olympian, in Vegas, and they may or may not be the current first place holder in one of
Wow.
the divisions.
Oh, that is
So,
incredible. Wow.
yes. Yeah.
That gives me chills. That's so
Yeah.
cool. Yeah.
Yeah. I'm very excited, but yeah, and not that it's, like, a huge secret, but
Also, like,
nothing's
privacy and
really
stuff.
set in
Yeah.
stone yet, so I don't wanna, like, promote
Totally.
it when it's not even, like, a booked out thing yet.
Yeah, I get that. Yeah, totally. I was like, I don't know if there's, like, privacy too and just kind of
Yeah,
waiting.
yeah,
Um,
yeah.
but is so with your business specifically, do you do you see yourself traveling to, like, some of these bigger pro shows? They took away the tier system, but, like, the big, like,
No.
Tampa, Texas,
Yeah,
Chicago, Pittsburgh,
exactly.
like, is that something that you're looking to do, or do you think you're just gonna stick to, like, the big ones, like Olympia?
Yeah. Honestly, I feel like the sky is the limit. I'm not opposed to anything. If there's a need for it, I will do it.
Yeah.
Um, I never in a million years thought that I would have the opportunity to go to the Olympia of all places. But that is happening. So,
Yeah.
there's nothing that could be better. So my plan is to just have a demand for it. And if there is, then I'll do it. I'm not opposed at all.
Amazing. Well,
Yeah.
we're gonna see your name everywhere, I have a feeling, the next few
I
years.
I appreciate that. I'm very hopeful and I'm very optimistic.
Yes, I am too. So, as we kind of get closer to the end of the hour, I do want to wrap up a little bit, but what advice would you give to athletes who haven't tried body work yet?
I would say try it. And I would just say that you really have nothing to lose, but everything to gain. And with that, all it's going to do is improve things, whether it's pulling out detail, whether it's improving your posing, improving your training. You really don't have much to lose if it's not for you or you don't like it, if it's too intense or not intense enough. That's okay, but just try it and see what changes you get in your body and then go from there.
Yeah, absolutely. That's always the answer. Just give it a go, give it a
I
try.
know. And
Yeah.
I really feel like there's nothing to lose but everything to gain with it
Yes,
because everyone has some type of asymmetry, imbalance. Even if it's just to like feel better when you're training, that's way good enough reason to do it.
absolutely. It's like the foundation of bodybuilding. Your
Yeah,
training holds so much of how far you can go in the sport. You have to build the muscle, you have to have the shape, you get the shape through the
exactly.
muscle, and that's all from training. So,
Yes.
cool. Are there any misconceptions about body work that you would like to address?
I think the biggest misconception would be that it can be a little like a spa like treatment, that it's more of a massage. I do have a lot of people reach out to me and be like, "I'm looking to get a massage. Is this what you do?" And when people ask me that, I say yes and no because I'm not a massage therapist, but massage is a part of the treatment. But I think the biggest thing is just to stay informed on what your needs are, be aware of what you think you need, and then go from there. Like we said earlier, if it's more of maybe a joint restriction, an ongoing issue, bodywork is probably your best bet. If it's something like muscle strain or just kind of sore overall, then maybe massage therapy is more of your thing. Um, I really think again anybody can benefit from body work, but it's just kind of finding the right person to do it. I know a lot of people in this area have come to me and said, "I've been looking for somebody who does this type of work, but there
Mhm.
just hasn't been anybody." And it's true. There's a lot of massage therapists, there's a lot of chiropractors, but it's not body work. It's a little bit different. So I think just finding somebody in your area who does it is your best bet.
Cool. Yeah, I love that, and I think us clarifying the difference between a massage therapist, like an LMT, and a chiropractor,
Mhm.
and then somebody who does do body work specifically with
Mhm.
things like cupping, Graston, using more manual techniques like that. I think that's
Mhm.
really important too, because there is a difference, but it's not
Right.
always specified.
Exactly.
So I think that that's valuable. Yeah.
Yeah. And it's not to say that, a massage therapist or a chiropractor can't do body work. It's it's just the service that they provide. I've
Hmm.
been to massage therapists who use cupping and scraping. Um, but again, my advantage is that I've gone to school and learned manual therapy techniques just from working in physical therapy. So You may not get that with a massage therapist. You may get that with a chiropractor. But it really is just kind of who fits what you need the best.
Yeah, and, to me, it's kinda similar to coaching, like, when you get into fitness, you get into competing, there are a lot of choices for coaches, like,
Yeah.
there are a lot of
Mhm.
choices and a lot of people who provide the service that you're looking for, but it is worth trying
Yeah,
different things, not being afraid to try somebody different or something different because you just never know, but
exactly.
the key is in trying, try the thing.
Exactly. Yeah, and sometimes it takes a couple people to go through, to find one that works, and whether it's a preference of maybe it's a male versus female, or maybe it's, distance close to your house, like, there's so many factors that go into it, and I think that there is somebody out there for everyone. Some people may not like the service that I provide, whether it's just how I run things, because I'm a female, whatever the case is, whatever their reasoning is. Um, they might not like it. And then there's somebody who loves it. So it,
Right.
it goes either way.
Yeah, yeah, just I think understanding and accepting that is cool too. There's athletes that I love to work with, and there's athletes that we just didn't click and they went to another coach, and that's okay. Like, not
Right.
everybody's gonna
Right.
yeah, yeah, so totally, I get that. Um, so, actually, is there anything that I haven't asked you yet that you wanted to talk about?
Honestly, I don't think so. I think we pretty much covered everything. Um, yeah, I think that the biggest things are, what to look out for when you're looking for someone, or like if it's time to get body work, things like that. But,
Mhm,
I think the biggest thing is to just do something. Also, another misconception is that people think that they have to choose between like massage therapy and like body work. And I was just having this discussion with one of my clients yesterday, and because this client specifically has been getting massage therapy for, I think he said about 4 years with the
mhm,
same person. And then he's coming to see me and has since stopped seeing his massage therapist. So we were talking about it, and I said, you can still get massage. Like, that's what we're doing are two different things.
yeah,
With him specifically, we're addressing issues that have taken years to come up into his body. So now it's going to take some time to fix them and retrain your body to work as it should. But I was joking with him and said that I felt like a side piece because, like, he's like, I feel like I'm cheating on my massage therapist with you. And I was like, I know, but it doesn't have to be
it's
like
not the
that
same,
because the
yeah.
service is totally different. Like, you can still have your main piece and your side piece.
Yes, they can coexist. It doesn't have to
Exactly,
be
we
s
can live
yeah.
cohesively. But I think that's just the biggest thing is people feel like, "Well, I'm loyal to this massage person, I don't wanna change it up on them." You can do both. Both are equally as beneficial, and they serve different purposes.
Yeah. Yeah, absolutely. That's so key, and that's actually something I learned last year. My last prep
Mhm.
was I was going to the chiro pretty frequently to fix my, like, hip imbalance because it was affecting my
Yeah.
glute growth, and then I was getting massage therapy, and then I found someone here in Austin who I really love for body work, and the
Mhm.
same thing, I had that exact same conversation because I was like, "Well, since I'm coming to see you, like, I don't need to see the other people," and he was like,
Right.
"No, you should still see the other people. You should
Right,
still be
right.
going and, like,
Yeah,
getting your adjustments, like, get that massage, like, do that."
yeah.
So, it is funny that, like, for us, we're just like, "Okay, I'll just do this one thing and it'll be
Right.
fine." It's like,
Yeah,
no, a lot of the time, you can do multiple because they're all gonna do slightly different things, but they're all gonna benefit you in some way.
exactly. Yeah, and I think too, if people understand that it's not gonna be fixed in one session. Your body has its way of compensating and doing things and
Yep.
accumulating these issues for up to however old you are. And so it's not going to be fixed in one session, probably not even in a month. It might take some time to resolve it. So I think that's also one of the things where it's like just give it a try, stay consistent with it. and then go from there.
Yep. Give it time to work, give it effort, and then
Yeah.
and then make your judgment call from there. But chances are it is going to help. Like
Yes.
it's going to help
Yeah,
you.
exactly. Again, you have nothing to lose.
Yes, nothing to lose and everything to gain. I love that. I love
Exactly.
that saying.
Yeah.
Okay. Cool. Well, where can our listeners learn more about you? Go ahead. Shameless plugs.
Yes, yes. So I will be again, I will be at the Olympia. So I do live in Michigan and work out of Michigan, but that is an opportunity for not only Olympia qualified athletes, but anyone, whether you're in an off season or prep, to come and see me get body work done. So I am taking any and all athletes that will be in attendance to the Olympia. Um, so you can get work done by me, and then also you can find me on Instagram. It's just Moroz Bodywork. That's where I post a lot of videos. If you're still kind of like, I'm not sure what this entails, I try to put a lot of videos out there that allow people to understand like what does a session look like. So those are the two spots that you can find me. And then my link to book on there is directly on my Instagram page. So booking for day-to-day sessions, and then Olympia booking is on there too.
Woohoo. Okay, perfect. And I'll make sure I have those in the show notes as well. So for those of you
Perfect.
guys listening, her links will be listed down below in the description box or in the show notes. So they'll be able to click the link directly there as well. But
Perfect.
Marissa, it has been amazing chatting with you. Is there anything else that you'd like to say?
Honestly, just thank you. Like, thank you so much for having me on. I have
Yeah.
been a big fan of the show. And, I think that the reason for coming on today and wanting to do this was because I've had so many people be like, I didn't even know this existed. And they would be pretty seasoned bodybuilders. So I think that it's important to just get the message out there and say, this is a service that's out there and you should be doing it. And come to me if you need it.
Yeah.
So, thank you again. And I give all my glory to God because I could not do this without him. And again, I cannot believe that this is what I get to do.
Yeah.
So,
This is your life and it is amazing.
yes, it is.
Well, it was great to have you on here. I'm so glad that you reached out to me. I love this conversation. I think that our listeners are going to as well. And if you guys liked this episode, as usual, it helps me out a ton if you could like, share, subscribe, send it to a friend who needs body work, because I know you
Yes.
guys know people who need body work. But
We all need
we
it.
do. We all need it. Until next time, everyone, thank you for being here and stay relentless.